comprehensive guide to breast cancer types and stages, a visual walkthrough. I'm Dr. Gatas, your guide to understanding breast cancer. Today, we'll delve into the different types and stages of this disease, making the information accessible for those facing this journey. Let's begin with the pathological types. The two main types are invasive ductal carcinoma, IDC, about 70% of cases, and invasive lobular carcinoma, ILC, around 20%. Within these types, we have special types based on their unique features. Hormone receptor positive, about 70% of cases. This subtype tests positive for estrogen or progesterone receptors. Treatment often includes hormone therapy, as these cancers grow in response to hormones. HER2 positive, around 15 to 20% of cases. This subtype tests positive for the human epidermal growth factor receptor 2, HER2, a protein that promotes cancer cell growth. Targeted therapy against HER2 can be highly effective in treating this subtype. Triple negative, approximately 10 to 15% of cases. This subtype does not test positive for estrogen, progesterone, or HER2 receptors, making it more challenging to treat. Chemotherapy and immunotherapy are often used, and ongoing research aims to find more specific treatments. Triple positive, included in hormone receptor positive and HER2 positive categories. This subtype tests positive for estrogen, progesterone, and HER2 receptors. Treatment may include a combination of hormone therapy, targeted therapy against HER2. Before we dive into the stages that describe invasive breast cancer, let's take a moment to understand Stage 0, also known as ductal carcinoma in situ or DCIS. DCIS is a precancerous condition where abnormal cells are found in the lining of a breast duct, but have not spread outside the duct. Think of it as a warning sign. These cells could potentially evolve into invasive cancer, but at this stage, they're contained. Treatment for DCIS often involves surgery to remove the abnormal cells and may include radiation therapy. Hormone therapy may also be recommended for some. Now, let's explore Stage 1 of breast cancer. The tumor at this stage is small, typically less than 2 centimeters, and has not spread to the lymph nodes. Imagine a small seed that hasn't had the chance to grow or spread. That's what we're dealing with in Stage 1. Treatment at this stage is highly effective and often involves surgery to remove the tumor, possibly followed by radiation therapy. Hormone therapy or targeted therapy might also be used. The prognosis for Stage 1 breast cancer is very favorable, especially with early detection. Moving forward, we reach Stage 2, a more advanced stage of breast cancer. The tumor has grown larger, exceeding 2 centimeters but still less than 5 centimeters, or it may have started to spread to nearby lymph nodes. Think of it as a plant growing bigger, but still confined to its immediate area. It hasn't spread far but needs to be addressed before it does. There are subdivisions within Stage 2, often referred to as 2A and 2B, which provide more detail about the size of the tumor and the extent of lymph node involvement. Treatment at this stage is individualized and may involve surgery, radiation therapy, targeted therapy, immunotherapy, and possibly chemotherapy. While Stage 2 is more serious than Stage 1, it's still highly treatable, especially when managed with a comprehensive and tailored treatment approach. Stage 3 breast cancer represents a more complex and critical stage. The tumor may be larger, possibly over 4 centimeters, and there's often evidence of cancer in multiple lymph nodes. Imagine a tree with branches reaching out. The cancer is grown and extended, but it's still confined to the breast area and nearby lymph nodes. Treatment typically begins with chemotherapy in combination of targeted therapy and/or immunotherapy to shrink the cancer cells, followed by surgery and then radiation therapy. In some cases, Stage 3 includes inflammatory breast cancer, where the breast may appear swollen, red, or thickened. This specific type requires an aggressive treatment approach. While stage 3 is a serious diagnosis, with the right treatment plan and diligent care, many patients successfully manage this stage and move forward in their recovery journey. We have now arrived at stage 4, also known as metastatic breast cancer. The cancer has spread beyond the breast and nearby lymph nodes to other parts of the body. Imagine the branches of a tree extending far and wide. The cancer cells have traveled to distant organs, often affecting the lungs, liver, bones, or brain. Treatment focuses on controlling the growth and spread of the cancer, with options including chemotherapy, hormonal therapy, targeted therapy, or immunotherapy. Supportive care, such as pain management and emotional support, is also crucial at this stage. While stage 4 is a serious and often incurable diagnosis, many patients live with metastatic breast cancer for years, managing it as a chronic condition. Advances in treatment continue to improve outcomes and quality of life. Communication, understanding, and a strong partnership with the healthcare team are vital for navigating this stage. It's a journey of resilience, hope, and personalized care. In understanding breast cancer types and stages, remember that knowledge is your ally and hope is your guide. You have the strength and courage within you to face this journey. Lean on your support system, trust in your care, and never lose sight of the resilience that defines you. Together, we'll navigate this path with hope and determination. Transforming battles into victories, one patient at a time. Tharwat Gatas, MD.